Well, good morning. It looks like some people are still logging in to join us, so I'm going to hold off starting this for just another minute or two to give people a chance to log in. But this is an introduction to Medicare presentation, and you're in the right place if you've come here this morning to learn a little bit more about Medicare, how it works, how you enroll, and have questions about that process. But as I say, it looks like people are just a little bit late. So if you don't mind, I'm going to give it like one more minute before we start, and then we will go ahead and get going with the details on this. I think in the meantime, I can tell you that the uh, program is presented by SourceWise, which is functions as the Area Agency on Aging. It's a not-for-profit organization that provides a range of services for seniors. And in fact, I can go through some of that. SourceWise has been around for quite a while, and its whole role is to support seniors here in Santa Clara County. Has a variety of programs. Uh, this is a list of some of the different programs that SourceWise has. Among the ones that are very useful to a lot of people, you see things, you've probably heard of Meals on Wheels. You've probably heard of uh, the senior employment services, for example. One of the key programs that it has is the Information and Awareness Group. And they can provide information about a variety of resources for seniors and senior needs that go beyond some of them that are listed here. The program that I'm involved in is a health insurance counseling and advocacy program, which we refer to by the acronym HICAP. And so to back up for a moment, since more people are joining us, my name is Abe Wishnia. I'm a volunteer Medicare counselor with the program. I've been doing this for going on 10 years now as a volunteer Medicare counselor and for several years as a community educator doing presentations, excuse me, such as this over Zoom or in-person presentations at various senior centers around the county. So the program that I'm involved with, as I said, is the Health Insurance Counseling and Advocacy Program, which we refer to as HICAP. It's a part of a federal program. It's federally funded. Uh, it's not affiliated with the insurance industry. The federal name is the State Health Insurance Assistance Program, which we refer to with the acronym of SHIP. Um, the program, depending on the state, has a variety of names depending on the state that you live, where the program is, but it's all over the country. Here in California, as I said, we call it the Health Insurance Counseling and Advocacy Program. And HICAP, our purpose is to provide free, objective information, unbiased information about Medicare uh, to help you make the best decision for your particular circumstances. We do the counseling services on the telephone. We do them in person at various senior centers and other facilities around the county. And we also do video counseling. Video call counseling is very similar to what we're doing right now. The phone numbers that you see up here are going to be coming up again during the presentation. For the SHIP program, for people in other states, you find out the contact information at the SHIP website at shiphelp.org. And there's a number for the SHIP program in other California counties. And again, we'll refer this for you. One of the things that you should know, the presentation that I'm doing this morning, the slides, they will be available to you later today. One of the staff people at HICAP will send out an email to all of you who pre-registered for this that contains a PDF of all of the slides that I'll be using this morning. So you don't need to copy anything down, to scramble to get those written down, those phone numbers, websites, dollar amounts, things like that. And this webinar is being recorded. And so that email will have a link to this recording. So if you want to view it again, maybe you missed something, it'll give you a chance to see this again and have it for future reference. So there's a lot that we're going to cover this morning, and here's a list of what I want to go through that I want to leave you with. I'm going to talk about how to sign up for Medicare. I'll talk about Medicare premiums, I'll talk about the parts of Medicare. Part A, hospital insurance. Part B, medical insurance. Medigap, also known as Medicare Supplement Insurance, or insurance agents call it MedSups, but I'll talk about those and explain what that is. I'll talk about Part D, which stands for drugs, and it's prescription drug coverage. I'll also talk about Part C, the privatized alternative to Medicare, which has the marketing name of Medicare Advantage. I also briefly will need to cover some frauds that are going to be targeting you as people on Medicare. And then I'm, of course, will be constantly referring to where and how to get help. Now, I'll tell you that normally on these presentations, I have a staff member who is kind of handling the technical side of this, but he's not available today. So in terms of questions, I'm going to ask you to hold the questions until the end. Jot a quick note, hold the questions until the end. And after the presentation, I'll open it up to a Q&A, and I'll stick around and answer your questions as long as we need to cover what you need to know. But the presentation itself is going to run about 45 minutes. Just warn you about that ahead of time. So anyway, here's what we're going to cover. So why don't we dive in? First part, how to enroll in Medicare. Well, the easiest way, you do it through Social Security. The Medicare enrollment is handled through the Social Security Administration. And the easiest way to do it is to enroll online via the Social Security website at ssa.gov, as you see here on your screen. You can also enroll by mail. You can also enroll by fax for people who still use fax technology. You can do it by phone, and you also can make an appointment and enroll at a Social Security office. But I'll tell you, if you do it by phone, sometimes you run the risk of an hour-long wait on hold just to get to somebody. And the Social Security offices now only work by appointment around here. So the easiest way to do it is online. It's not that difficult. Now, if you're already receiving Social Security benefits before the age of 65, Medicare is going to enroll you automatically. You don't have to do anything. Just shortly before your 65th birthday, you'll receive a Medicare card in the mail. And then, of course, you'll take the next steps that I'm going to talk about as we go into the presentation. Now, for those of you turning 65, there's something called an initial enrollment period, this IEP. It's a 7-month window that is centered on the month, not the day, centered on the month that you turn 65. So it's the 3 months prior to turning 65, the month you turn 65, and the 3 months after you turn 65. And if you enroll before your 65th birthday in that 3-month earlier part of the window, your coverage would be effective the first of the month that you turn 65. If you enroll the month you turn 65, the coverage generally starts, and with any of these other months, starts the first of the month after you enroll. Now, what about people who are still working and covered by an employer health plan? Well, you don't have to enroll in Medicare under those conditions if you are still working and covered by a workplace plan, your workplace or your union plan, or that of your spouse. You get what is called a special enrollment period. You can continue working, continue with that workplace coverage, and then when that coverage ends, let's say you decide you're going to work past 65, and at some point you decide, all right, it's time to hang it up and retire. Well, when you know that that coverage is going to end, then you can enroll in Medicare. You get what they call a special enrollment period. And there are no penalties for enrolling under those circumstances as long as you have continuous coverage under your employer workplace plan. And again, it's your due to your job or your spouse's job. Now, and with the special enrollment period, you can enroll while you're working or after age 65 or up to 8 months after that employment coverage ends. There's a form that you're going to need if you do that, if that applies to you. It's something you download from the Social Security website. It's a CMS L564. It's a form that you download, you fill it in, and your employer signs it as verification that you've had continuous coverage during this period under the employer plan so that you don't get hit with any kind of a late enrollment penalty. And then coverage would start the month after you enrolled. But what if you miss that initial enrollment period? Or you miss that special enrollment period for whatever reason? Sometimes people just don't pay close enough attention. Well, there is another opportunity to enroll. It's called a general enrollment period, and it's each year during the first quarter of the year. We're in it right now, from January 1 through March 31, and coverage would begin the month after you sign up. If you miss that general enrollment period also, then you've got a problem because you won't have an opportunity again to enroll until the following January. And so you're going to run a year or more without coverage. And the problem is that you will get hit with a late enrollment penalty that is 10% of the Medicare monthly premium every month added on for the rest of your life. It can get very expensive very quickly, and there are other complications that happen after that in terms of getting Medicare supplement plans, which I'll talk about in a few minutes. So don't miss these enrollment periods. So to summarize, you have an initial enrollment period. That's that 7-month window centered on the month you turn 65. A special enrollment period, if you're still working after age 65 and covered by workplace or union plan or your spouse's workplace or union plan. And then the general enrollment period, January to March 31 every year. So Medicare has premiums. Most of us, Medicare Part A is free in the sense that the premiums are covered by deductions that were taken from your paychecks through your working years. And as long as you work the equivalent of 40 quarters, what they call 40 credits, or essentially 10 years, there's no cost for Part A. However, some people don't have that number of work credits. They didn't either work that long, or maybe someone who is an immigrant who doesn't have the work history in the United States, but is otherwise eligible for Medicare. You can still get Part A, but there's a premium attached. As you see here, the premium is based on the number of credits that you have. And if you have less than 30 credits, you can get Part A, but the premiums are going to be $565 a month. Part B also has a premium. It's something that everyone pays regardless of how their Medicare is structured. And that premium this year is rounded to $203 a month. Everybody pays this. And when you enroll in Medicare and you start collecting Social Security, they will deduct that from your Social Security benefit. Now, there's some people who are very high earners. Medicare is heavily subsidized. You can't buy any kind of health insurance, as I'm sure you all know, for the kinds of premiums that are there in Medicare. And so for high earners, Congress wrote in basically a subsidy reduction. They call it the income-related monthly adjustment amount, or we refer to it as IRMA for short. And as you see on these tables, depending on what your income is, if you're filing jointly as a couple, and your modified adjusted gross income, that's your adjusted gross income plus adding back any tax-free income that you had, such as government bond income, for example. If that amount is greater than $218,000 on a joint tax return, you'll see over these other columns how much it would add to your monthly premium, and on the far right column, what you would end up paying Social Security, your Part B premium plus that adjustment amount. And the adjustment amount is based on your most recent tax return. So currently, here in the year 2026, people filed a tax return last April of 2025 for income in 2024, right? We filed the following year, tax year 2024, tax return filed in 2025. The IRMA rates are reflected in 2026. And each year, as you file a new tax return, there'll be an adjustment in the IRMA rates. It could cause your IRMA to go up, or it could cause it to go away. But it's an adjustment each year based on your modified adjusted gross income on your most recent tax return. Now, The other side of it is there are a lot of very low income people, and there are programs to help them with the costs of their Medicare coverage. If that applies to you or to someone that you care about, make an appointment to talk to one of our HICAP counselors. We can explain to you how these programs work, what the qualifications are, and help you understand if that's something that would work for you and help you with applying for it. Remember the famous baseball player Yogi Berra? Well, he famously said that when you come to a fork in the road, take it. Well, with Medicare, once you enroll, you are going to come to a fork in the road, and you cannot just stand there. You're going to have to pick one direction or the other. You're going to have to choose whether to go with original Medicare, where you've enrolled in Part A and Part B, and then you add a Medicare supplement plan, and you add a prescription drug plan. Or whether you go in the other direction and go with Part C, also known as Medicare Advantage, that is the privatized version that bundles all of that together. And I'm going to explain each of those, how they work, and a little bit about the pros and cons of the one versus the other. So first with original Medicare. With original Medicare, this is the way the program was originally created. It's a fee-for-service model, just like any other business. You go to the doctor treats you, or some other provider treats you. They've provided a service. They're allowed to submit a bill. They get paid for the service, fee for service. Just like you go to the store, you buy something, you pay for it. You don't go to the provider, you don't get their service, they can't bill you. With original Medicare, you can go to any doctor, any hospital, any other health provider, anywhere in the United States who accepts Medicare. And as far as doctors, the number varies, but it's typically something north of 95% of all doctors accept original Medicare. Pretty much all hospitals accept it. Original Medicare does not have network restrictions. It's not an HMO. It's not a PPO. There's no network. There's no restrictions. You don't need to have anyone's prior permission to go see a specialist. You can see any doctor, any provider who accepts Medicare, and you can contact them directly. You don't need permission from your primary care physician. And again, it's not like a PPO, like so many workplace plans. There are no network restrictions of any kind. Now, Part A is hospital insurance, and it covers you when you're an inpatient in the hospital. It will also cover skilled nursing care under certain circumstances. Let's say you've been hospitalized because of some kind of major surgery. You're improving. You're not quite ready to go home, but you don't need to be in a hospital anymore. But maybe the right place for you for a while during your recovery is in a nursing home. Under certain circumstances like that, Medicare would cover the skilled nursing care. It would cover home health care as a result of perhaps that surgery. You need some home health care as part of your recovery. Part A would also cover hospice care. And hospice care is defined as for someone who's diagnosed with a terminal illness and typically has an expectation of 6 months or less to live. Hospice care is not curative care. It's palliative care designed to keep you comfortable during those final days and months. Part B, and I should mention Part A does have deductibles and it does have copays. Part B is outpatient care. That's when you go to the doctor's office or some other provider. Laboratory services like blood work or x-rays, the annual preventive services like the annual wellness exam or flu shots, for example, and various kinds of preventive services. It also can cover home health care under certain circumstances. Maybe you're injured, you don't need to be hospitalized, but during your recovery, maybe after you've hurt your knee playing pickleball or something, and you need someone kind of coming into your home for a period during your recovery. Part B, that's a Part B kind of service. Physical therapy, for example, or durable medical equipment like crutches, wheelchairs, things like that. Now, Part B, as I said, there's an annual Part B premium that everybody, or monthly Part B premium that everybody pays, and there's an annual Part B deductible of $283. Now, Part B also has a 20% copay, and here's how that works. You go to see the doctor treats you, and the doctor submits a bill to Medicare. And let's say the contract amount for that service for Medicare is $100. Medicare doesn't send the doctor, pardon me, doesn't send the provider $100. Medicare sends them 80%, or in this case, $80, and you are responsible for the other 20%. Well, 20% of how much? And that's going to lead to what I'll talk about in a moment about Medicare supplement insurance that deals with these copays and deductibles. Now, there's some things, first of all, I need to mention that Medicare in general does not cover. Medicare does not cover long-term care in a nursing home. It's a very steep expense, but that's the way the law was written. Medicare doesn't cover it. Medicare does not cover routine dental, such as fillings, cleanings, implants, things like that. Just not covered. Medicare does not cover dentures, doesn't cover routine vision. And by routine vision, I'm talking about things like eyeglasses or contacts and the exams for those. It doesn't cover hearing aids. Even if you have profound hearing loss, the law was written that Medicare does not cover hearing aids or does not cover the hearing test to see do you need a hearing aid. Don't ask me to explain why that kind of coverage was written into the law. It's just there. It also doesn't cover cosmetic surgery or things that would be considered elective. And it's important to know that Medicare does not cover you outside of the United States except under some certain very special circumstances. You can find out on the Medicare website whether a service or treatment is going to be covered. They have a search function there that you can find out and get an idea before you commit to something like that and spending money that you weren't having to pay for something that you weren't expecting to pay for. Now, remember I talked about those copays and deductibles. Well, because of that, that led to an additional type of insurance called Medicare Supplement Insurance, also known as Medigap. Medigap, Medicare Supplement, two different terms for the same thing. These are plans sold by private insurance companies that are designed to help you with these out-of-pocket copays and deductibles. As I said, they're sold by private insurance companies. And these are standardized plans. Standardized meaning they sell these plans, they have to follow federal rules, Medicare rules, and provide the same kinds of coverage. And I'll explain those in a moment. They gave them letter designations, and category designations, Plan A, Plan B, C, D, etc. Those letters have nothing to do with the parts of Medicare that have those same letters. Someone decided to give them the same letters. They could have called them 1, 2, 3, 4, 5. But in order to sign up for a Medigap, Medicare Supplement Plan, you have to be enrolled in both Part A and Part B before they will sell you one of these plans. So here's how they work. You're going to have these slides, as I mentioned, are going to be in an email that is going to be sent to you. And the email will also include our consumer guide. That goes into more details on some of these charts, and you'll be able to reference that. But here's how you're going to use what you get in the consumer guide. There's a section in there with this dark blue header that explains Medicare supplement plans. And this particular chart, if you look at the left-hand side of the screen, it shows the various kinds of benefits under Medicare for which there are deductibles and copays. As you go across, you see in the dark blue with the white letters, the plan categories, Plan A, Plan B, Plan D, G, K, L, M, N, C, and F. Okay. Now, the way you read this is you go across. If there's a dot in the intersection, it shows that that plan covers that benefit. So, for example, Plan A has dots in 4 intersections. Plan Bs have dots in 5 intersections, etc. The only plan that has a dot in all intersections is the Plan F, but that's only available to people who became Medicare eligible before 2020. Otherwise, the plan with the dots in the most intersections is the Plan G. The only thing that's not covered is a Part B annual deductible. And Congress passed a law during the last Trump administration that said new enrollees, new plans could not cover that Part B deductible. They felt that you didn't have enough skin in the game. So the only plan that can still cover it is the grandfathered in Plan F. But here's what you need to know. Every Plan G is identical in its coverage to any other Plan G. They all cover the same thing. Any Plan A, identical to any plan, other Plan A, any Plan F, etc. So here's the thing. These are sold by private insurance companies. They can charge whatever they want. The only difference between the plans is the insurance company that sells it and the premium. So in that handout, you'll have a series of pages where we list the plans available here in alphabetical order by the plan name. And I pulled this one particular page just to show you something. On the left, you see that when we put this together several months ago, we listed premiums at the time in 5-year increments, so under 65, 65, 70, et cetera, as you go down here. Then the plan categories, and then the premiums that we were able to find for those insurance companies. And again, the insurance companies are listed strictly in alphabetical order. But look here, for a Plan G, for a male at age 65 who's a non-smoker, this plan charges $223 a month. This plan charges $152 a month for the same exact product. So what I tell people is, if you're going to get a Medicare supplement plan, if you're going to get a Plan G, get the cheapest one. Don't buy it based on the name of the company. Don't buy it based on the fact that you've seen their advertisements or who they're affiliated with. Get the one that's the least expensive. Would you rather pay $152 or $223 for the exact same thing? Get the one that's the least expensive because they're identical products. They work the same way. Now, you have to, if you're going to get a Medicare supplement plan, you have to enroll in it when you first enroll in A and B. It's either during your initial enrollment period or during a special enrollment period. If you enroll at that time, they cannot deny you for pre-existing conditions. They can't ask you about your medical history. However, if you wait past that initial enrollment period or that special enrollment period, they can ask you about your medical history. They can deny you or charge you a higher premium. And I've worked with people as a counselor who get in trouble because they overlooked something like this and they can't get the Medicare supplement plan. Now, sometimes there are certain other rules that will give people a break that happen about once a year. They're not relevant right now, but we talk more about these as we get closer to Medicare's annual enrollment period. Now, the way to find these Medicare plans, find out more about them, and to get updated estimates of the premiums is through the Medicare website. They have a plan finder tool that I'll talk about in a moment at the Medicare website at medicare.gov. But those premiums are going to vary depending on where you live. They're going to be higher in one county than another. They're going to be different in different states. They are based on zip code and on your age. And you do have to contact the plan directly to get a specific quote for you. So now let's shift and talk about prescription drug coverage. We have 12 prescription drug plans available in California this year. If you're in original Medicare, you have to have prescription drug coverage. Even if you're healthy, not taking any medications, you don't know what's going to happen next week. You need to be protected for the cost of these prescription drugs. Now, you can get one of these plans if you have either Part A or Part B or both. And I should mention that all but 3 of the Medicare Advantage plans that we have available in our county this year include prescription drugs in their coverage. Now, you don't need to get a separate drug plan if you have what they call other creditable coverage. And so a typical example might be someone who gets their prescription drugs through VA. They have VA benefits and can get their medications that way. If you can get them that way, you don't have to enroll in a Medicare prescription drug plan and you won't be penalized. The plans are sold by insurance companies. And as with the Medicare supplement plans, they can charge whatever they want for the premiums. And this year, the premiums among those 12 plans range from a low of $0 per month. Yeah, that's right, 0, no monthly premium, all the way up to $227 a month. I think the company charging that $227 a month doesn't really expect anyone to sign up. I think we have 3 of them, 2 or 3 that are under $100 a month, or under $50 a month. They get expensive. As I say, up to $227 a month. The national average is, as you can see here, more than $30 a month. And these plans, they have deductibles that range from $0 to $615, and their copays are all over the place depending on the drugs and the policies of the plans. Here's a way to evaluate those plans. The Medicare website at medicare.gov. Don't go to medicare.com or medicare.org or medicare.something else. Those are owned by insurance companies, and they're going to try to sell you something. The only one of these sites that you can fully trust is the official Medicare website at medicare.gov. This is what the landing page currently looks like. Every couple of months, they change the person or persons in the picture, but they always position the people right behind this tab right here where it says Find Health and Drug Plans. They always position there. That's easiest way to find it. And you can see where it says Find Plans Now. Well, when you click that, it takes you to a page before this one where you enter your zip code, because your zip code helps determine what your costs are. And on this page, if you see over here, it will show you the type of plans you can choose from. You can use it to analyze and compare Medicare Advantage plans, Medicare drug plans, and Medicare supplement, Medigap plans. You click the button that you want, and then you click Find Plans. Well, I can't go into a full thing right now on how to use the plan finder, but it's not that difficult to use. It used to be, but not so much anymore. And we as Medicare counselors regularly help people through this process. So if it's something that you have difficulty doing, especially when it comes to figuring out your prescription drug plan, make an appointment to talk to one of our counselors. We help people with this kind of thing all the time, and typically do it either in person or in a video call. Now, remember I talked about IRMA? Well, IRMA applies to your prescription drug coverage also. And so regardless of the premium that you pay, if you're subject to IRMA, they're going to take this amount on the right and add it to your monthly premium for your prescription drugs. And even if you've signed up with the Medicare Advantage plan that claims to include prescription drug coverage with 0 premium, you're still going to be subject to IRMA there. But by the same token, for low-income people, to help them with their prescription drug costs, there's a program called Extra Help. And again, if you think that applies to you or someone that you care about, make an appointment to talk to one of our counselors. We'll explain it to you, how it works, help you understand whether you qualify and how to apply. Now, remember I talked about that fork in the road. I've just been talking about Original Medicare, where you've signed up for Part A and Part B, add a Medicare supplement plan because you have to have protection for those copays and deductibles, and you add a prescription drug plan. Excuse me, I'm going to need a sip of water here. The alternative over here, pick one or the other. The other direction to go is Medicare Advantage, which takes everything on the right side of the screen, bundles it all up into one card, so to speak, one-stop shopping. And I'm going to explain how that works. So the Medicare plans around here, almost all of them are the HMO model, Health Maintenance Organization. If you've had any experience with that or not, the best known example around here of the HMO model is Kaiser Permanente. Under those models, you get all of your care from the doctors and providers who have contracted with them, who are part of their network. We have 46 such plans that include prescription drug coverage available here in Santa Clara County this year. And all but 3 of the plans that are available here include prescription drug coverage. And those are plans really that are intended for people who have their coverage, say, through something like VA for drugs. Now, these are plans that are offered by private insurance companies. About 20 years ago, the political mood in Congress was that everything would be better if it's run by private companies instead of the federal government. And Congress wanted to privatize Medicare. The compromise they created was Part C, which they gave the marketing name of Medicare Advantage. And again, this is run by private insurance companies. So if you sign up with that, you're taking your Medicare coverage and trusting it to an insurance company. There are rules that go with it. You have to live in the planned service area. You have to get all of your care from the doctors or other providers who are part of their network, who have contracted with them. You have to select and see a primary care physician first. They become the gatekeeper for the plan. And if you're thinking about signing up with a plan and you like your current doctor, be sure to ask your doctor if they contract with the plan that you're considering. Because if not, you will have to change doctors. These plans will have copays, premiums, copays, deductibles are all over the place. They're set by whatever the plan wants to set them at. Some of the plans have a 0 monthly premium, but they also have out-of-pocket limits for all of your copays and deductibles, not counting premiums, and they can set that at whatever they want. They have restrictions. You have to be in their network. If you want to go outside the network, let's say you want to see a specialist in another part of the country or up at Stanford or something, no, your plan can say they're not going to pay for it. And if you want to go outside the network, you're going to pay for it on your own, out of your own pocket. And you cannot use a Medigap, Medicare supplement plan, to help you with those deductibles and copays. The law does not allow that. And these plans use something to control costs, something called prior authorization. And I'll talk about that a little bit more in just a moment. So the premiums here for this year range from $0 to $204 a month. They have out-of-pocket maximums, not counting premiums, that vary by the plan, and the highest ones here have an out-of-pocket maximum of $9,250. So that means they can charge you premiums and copays up to that amount before they finally have to cover everything else at no extra cost. They also will have deductibles for your drug coverage, anywhere from $0 to $615. Now, here's something that's important to know. If you want to see a Stanford doctor, you won't be able to use a Medicare Advantage plan. Stanford does not contract with any of the Medicare Advantage plans that we have here in our county. So oftentimes in my role as a counselor, I've met with people who are dealing with a cancer diagnosis and they want to see a Stanford specialist. Their Medicare Advantage plan won't pay for it. They want to see that Stanford specialist. They have to pay for it themselves. Palo Alto Medical Foundation is only contracting with one Medicare Advantage plan. It's one called Alignment Center Health. And Valley Medical Center and Regional Medicare Center have terminated their contracts with all of the Anthem Medicare Advantage plans and with the AARP United Healthcare Medicare Advantage plans. They're following a trend that we're seeing with a lot of hospitals around the country that have decided that dealing with Medicare Advantage plans is too much of a headache for the hospital, too much of an imposition on the patients, and they just don't want to contract with the Medicare Advantage plans. It's something to keep in mind that you could find limitations on where you're going to get your care. Now, in the handout that will be coming in the email, there's a section in green like this that covers all of the Medicare Advantage plans that we have available in our county. And so, the top bar, it says Medicare Advantage plans. Then this next line, we organize them alphabetically by the name of the plan going from left to right. So alphabetically, the first one listed is the AARP Medicare Advantage United Healthcare. and you go across page after page, left to right. But for any particular plan, you analyze it by reading down the column where we break out what their copays and deductibles are. Their star ratings. Incidentally, the star ratings is something worth looking at because this is not like Amazon or Yelp reviews. These are star ratings that come, it's a grade given by Center for Medicare and Medicaid Services based on patient outcomes, patient complaints, how the difficulties patients are having with getting access to certain kinds of services. There are a range of these things. And you can see here, for example, a 2.5-star plan, a 3.5-star plan. There used to be only one 5-star plan in our county. That was Kaiser Permanente. They've lost a 0.5 star a couple of years ago. So there are no 5-star plans here. But give careful thought before you sign up a plan that has less than 4 stars. They have this bad grade or weaker grade from Medicare for a reason, and it's something to keep in mind. But anyway, you have this, and this gives you information about all the plans. And then, as I pointed out earlier with the Medicare Plan Finder, you can use that to also dig deeper into these plans to get an idea of the doctors in their networks. Now, for how this all works. So remember, I said original Medicare is a fee-for-service model. You see a provider, they charge you for the service, they get paid. You don't see a provider, they don't get paid. Medicare Advantage is different. It's a capitation model. What that means is these plans negotiate a fixed monthly fee with the government to provide your care, and their monthly fee is capped at whatever that negotiated fee is. It's capped at that for the year per month. And so they take, the amount that's your Part B premium, an amount for Part A that they have, and they bundle all of that together with some additional money for administrative and other kinds of costs and bonuses for plans that do a better job of meeting their goals. And they send that fixed monthly fee per month to the plan. Now, around here this year, the best number I've been able to find is that fixed monthly fee on average is $1,500 per month per patient, per member of the plan. $1,500 a month. The plan gets that. If you're healthy and you only need to see the doctor once a year for the annual wellness exam, that plan is still going to get that average of $1,500 a month, even if they never see you or never treat you. On the other hand, let's say something happens and you need major surgery and have to be hospitalized. Knee replacement surgery can run well over $100,000. Let's say you need that and they finally approve it, or if you need it at all. They're still only going to get that $1,500 a month on average, regardless of how much care you actually need, even if you have to be seeing a doctor once a week. So the problem is they have to manage those costs, and they manage those costs by managing care and using something called prior authorization. So in the example of that knee replacement surgery under original Medicare, you need that surgery, you go to see the doctor, you and the orthopedist decide, yes, you're a candidate, and whenever you're ready, go ahead and schedule it. They can schedule it, they do the surgery. With the Medicare Advantage plan, you would first have to see your primary care physician to get the referral to the specialist. And your primary doesn't necessarily have to give you that referral. But you get the referral to the specialist. The specialist might say, yeah, you're a candidate. Before they can schedule it, they have to go to the insurance company and get prior authorization. And the insurance company, and the person making the decision is not necessarily a medical professional, can say no. They can say, no, we don't think this person needs it yet. Let's have them do some more physical therapy. Let's try some more injections or whatever. But they can say no. You can appeal it. And very few people do appeal, but most of the appeals, ironically, do get overturned. The denial gets overturned, but not enough people to go through the process of appealing because it's a headache. So they use prior authorization to control costs. So the differences between original Medicare and Medicare Advantage, one is where you go for care. With original Medicare, you can see any doctor anywhere in the country who takes Medicare. With Medicare Advantage, you are restricted to their network of providers. Prior authorization, original Medicare, essentially, except for some very limited cases that are being tested, does not use prior authorization, does not require it. Medicare Advantage does. The premiums and out-of-pocket costs. Now, here's where a significant difference. With original Medicare, everybody pays the Part B premium, but with original Medicare, you have the cost of a Medicare supplement plan. You also have the additional cost of a prescription drug plan. Whereas with Medicare Advantage, there are a lot of plans that have a 0 monthly premium and include prescription drug coverage. And you don't have the cost of a Medicare supplement plan because you're not allowed to get one. And so for people who are very low income, maybe still do not qualify for other kinds of aid, they can get their health care without the burden of those extra monthly payments. Now, the Medicare Advantage plans do advertise oftentimes heavily their extra benefits, which vary by plan, but they will offer sometimes some amount toward dental or some limited coverage for vision or assistance for hearing aids, and sometimes over-the-counter medications that Medicare just does not cover. But these plans make their own rules as to who has access to those benefits, how to access those benefits, and whether they even continue those benefits, because oftentimes people sign up for it and then the plan changes and the benefits get eliminated. One really, I think, valuable benefit of the Medicare Advantage plans is underwriting for pre-existing conditions. Remember earlier I mentioned someone who might have missed their initial enrollment period and the special enrollment period and the general enrollment period. They can't get a Medicare supplement plan for whatever reason. The Medicare Advantage plans have to take them anyway. The Medicare Advantage plans cannot deny you because of pre-existing conditions. So if you're someone who missed some of these opportunities, can't get a Medigap plan, have serious health problems, the Medicare Advantage plans have to take you. And that can be, that's a major benefit under those circumstances. Now, there are, Medicare Advantage plans are great if you're in good health. They can save you a lot of money. They love people who are in good health and don't have to see the doctor because they get money from Medicare and don't have to spend that money on treating them. But it can be a real problem for people dealing with serious health conditions who need to see out-of-network specialists, or people who need complex surgeries like for cancer or heart surgery or joint replacement surgery. Or it can be a problem who need additional care in a skilled nursing facility while they recover from an illness. There's some major national lawsuits going on right now about plans essentially refusing, Medicare Advantage plans refusing to continue covering people who their doctors feel still need to be in a care facility. The Medicare Advantage plans kind of argue that they do, by managing care, they provide better outcomes, better health for their members. That's their ongoing argument. But there's some dispute of that. This is from the Journal of Clinical Oncology. That's the professional publication for cancer doctors. And this study, the headline was Medicare Advantage, a disadvantage for complex cancer surgery patients. And what they did was they wanted to know, how does Medicare Advantage compare with original Medicare in terms of access and outcomes and cost for treating complex cancers that require complex surgeries? And what they did, they looked at the medical records of more than 76,000 Medicare beneficiaries comparing Medicare Advantage and original Medicare. And what they found was those who had Medicare Advantage plans had a significantly lower probability of getting their complex cancer surgery at high-volume hospitals. High-volume hospitals are those places that do a lot of this kind of thing and presumably have greater expertise. They found those people with the Medicare Advantage plans had a higher likelihood of dying in the first 30 days after those surgeries. But it costs less. The Medicare Advantage plans save money. Now, this was a study was done a few years ago, rather a report was issued by the Office of the Inspector General of the Department of Health and Human Services. That they're the parent agency for Medicare. This Inspector General, in fact, was just not too long ago fired by the Trump administration, but their report, this was the headline and the first paragraph of the report. And it said some Medicare Advantage organizations denials of prior authorization requests raise concern about beneficiary access to necessary medical care. And it said, this is the opening paragraph. It says, Medicare Advantage organizations sometimes delayed or denied Medicare Advantage beneficiaries access to services, even though the requests met Medicare coverage rules. Denying requests that meet Medicare coverage rules may prevent or delay beneficiaries from receiving medically necessary care. And then it went on to say a central concern about the capitated payment model used in Medicare Advantage is a potential incentive for insurers to deny access to services and payment in an attempt to increase profits. Now, sometimes people have asked me in the Q&A in these sessions, that sounds like I'm biased against Medicare Advantage plans. I think rather what I try to do by pointing these things out to you is that if you're going to go with a Medicare Advantage plan, I just want you to do it with eyes open, understanding that despite the glowing advertisements about how wonderful it is, promising the sun, the moon, and the stars, the reality is there are restrictions and problems that you're going to have to deal with as part of the trade-off for the cost savings that could come along with these plans. So just go into it eyes wide open. Now, you're not always locked into everything once you make the choice. It's not quite that bad. Medicare has an annual election period. It's also called an annual enrollment period, and it's also called open enrollment every fall from October 15 to December 7. And that's when you can switch drug plans, get one maybe that better suits your needs, lower costs. You can change from one Medicare Advantage plan to another. You can move from original Medicare to Medicare Advantage, or you can move from Medicare Advantage to original Medicare. The latter, moving back to original Medicare, you're going to have to find out whether you're going to be able to get a Medicare supplement plan, and that can be kind of tricky, but there are sometimes circumstances that allow it. We talk more about this annual election period with presentations that we do in the fall, starting in October, to help you understand what this period is and how to take advantage of it, what the changes coming up would mean to you. So reviewing where to enroll in Medicare. Well, Medicare Advantage plans, Part C and Part D, you contact the insurance company that sells it. With the drug plans, actually the easiest way to do it is the enroll online. And actually you can do both of them. You can enroll online through the Medicare.gov website. With the Medigap plans, you have to call the insurance company directly. Now, this is complicated, and a lot of people choose to work with insurance agents. I can understand that, and I have nothing against insurance agents or brokers, but something to be aware of. A number of the insurance companies that sell these Medicare Advantage plans and prescription drug plans late in 2025 announced that they would no longer be paying commissions or would be cutting commissions for many of those Medicare Advantage plans and many of those prescription drug plans. Now, insurance agents depend on commissions. That's the way they make their living. And so you run the risk that some agents and brokers who are not ethical might try to steer you to plans that only pay them commissions, or they may stop representing plans that don't pay them commissions. And so if you're going to work with an agent, they can be very helpful, very knowledgeable. Just be sure to ask them if they represent all of the Medicare Advantage plans or all of the prescription drug plans that are available here. So you can be sure you're seeing everything and having the broadest choice. If they don't represent all of them and you want more help with understanding, pardon me, get another sip of water here. If you want help with understanding those choices, again, I've got nothing against insurance agents, but our role as HICAP counselors is to give you unbiased, free information to help you understand those other plans that the agents might not be representing. So I have to talk briefly about Medicare fraud and abuse, because as you get enrolled in Medicare, you are going to become the target of scammers. And Typically, the scams lately tend to be phone-based, where someone calls pretending to be from Medicare or wanting to talk to you about your Medicare coverage. Medicare will never call you and ask you for your Medicare number. Some of these scams involve someone calling from Medicare and saying, hey, we want to make sure that you got your Medicare card. Good, now we need to activate the card. And they try to collect your Medicare number. You don't need to activate the card. There's no such thing as an invalid card that you need to change or a laminated card that you have to get. If anyone calls you out of the blue that you don't know and they want to talk to you about your Medicare coverage, it's likely a scam. Just hang up and never give your Medicare number to anyone who calls you over the phone and asks for it. Also, one of the current scams still goes on is about free genetic testing. You might see someone at a community fair someplace and they'll have a little table and they'll be offering free genetic testing, and all they need is to record your Medicare number. They'll take a picture of your Medicare card or want your number, and they'll give you a little test kit to send a swab back. Well, Medicare does not cover routine genetic testing. It only covers genetic testing if your doctor makes a case that it's medically necessary to help with part of a treatment plan, but otherwise Medicare doesn't cover it. So just remember, protect your Medicare number. And there's an organization we work with, the Senior Medicare Patrol. They work in terms of tracking down, helping prevent Medicare fraud. You can contact them through this number or through a Medicare counselor through the HICAP program. And so these are the numbers to call. This is how you get an appointment. I'll leave this up, but it'll also be in your handout. And so with that, I'm going to open this up to questions.